Hey guys, it's Dr. Roach coming to you again. So today I'm going to go over probably 8 common pediatric medications that you should probably know about in your residency or definitely in your pediatric rotations. So these are kind of 8 meds that I definitely recommend all pediatric residents should know these doses on top of your head. But family medicine, these should definitely be like right in your pocket. You should know these and be very familiar with them. And then students, PAs, these are ones that you should probably be common with and be comfortable giving out, depending on what your career goals are. So the first one, Tylenol. So this one's very common. It's probably the most commonly one prescribed. You can give it rectally. You can give it by mouth, which is PO, or you can actually give it IV. We don't really give it as much IV unless kids are in PO or something like that. But these are definitely medications that you should know about. So the dose is 10 to 15 mg per kg. You give this every 4 to 6 hours. When I go over ibuprofen, I'll tell you how I advise parents to rotate it. But basically, this is the dose that you would give if kids were in any pain or any fevers. Second one is Dexamethasone. And this you will usually give when a kid has croup. So this one you can give IV or PO. I've actually never given it IM. And the dose is 0.6 mg per kg. You give it one time. The max dose is 10 milligrams. And basically you just have to find the formulation that makes the kid take the least amount PO by mouth. So a lot of times you'll see that the PO versions have a small amount of milligrams per ml. So you just kind of do the biggest dose. In my former base, what we would do is we actually would give the IV version PO because it was a lesser amount that the kids had to take. Third medication, Benadryl. So Benadryl is basically used for any kiddos that have any local reaction, anaphylaxis, anything like that, urticaria. That's why you would give Benadryl. You can give it again IM, IV, or PO. I've given all 3. And the dose is generally 0.5 to 1 milligrams per kg every 6 hours. We most of the time just do 1 mg per kg because it's an easy conversion factor to use. Ibuprofen. This is a medication that you'll NSAID that you'll use a lot of times with pain, but as well with kids that have any anti-inflammatory, any musculoskeletal pain. This is a great medicine to use. So you'll do 10 mg per kg every 6 to 8 hours. The biggest thing that I advise parents on with this medication is GI irritation. So always taking this with food. It can cause ulcers, so you don't really want kids to be on this medication for a long time. A lot of times when kids come in sick, I'll tell parents to rotate Tylenol and ibuprofen. So if you take Tylenol at 12, ibuprofen at 3, Tylenol at 6, and ibuprofen at 9, you rotate something every 3 hours, and that way you will not overdose. Adivan. This isn't one that you will give. This is probably the least common one that you'll see on my list. This one you'll give for seizures, basically. And it's 0.1 mg per kg. Usually the max is 4 milligrams per dose. Do know that depending on your pediatric population and their weight, you do have to look up what the maximum rate is, especially on a lot of these medications. So, for example, Tylenol, the max daily dose you would give is 4 grams or 1,000 grams every 6 hours. So just know that there is a maximum, especially if a kid comes in and maybe they weigh 100 kilos or something like that, way past an adult weight. You do want to make sure you look up the max dose. Methylprednisone. This is another steroid that you'll see us use, as well as Orpred for kids that have asthma. Methylprednisone is one that's going to be IV. And you'll do it 1 to 2 mg per kg. Most of us will kind of, if you're admitted for asthma, will kind of hit you hard and go with 2 mg per kg. The usual maximal dose is 60 milligrams a day. That's in children and adults. So once the kid has transitioned, doing a little bit better on IV, you can transition to Orpred, which is the PO version. of this medicine. And the same thing, 1 to 2 mg per kg every 24 hours. You can give it once or twice a day. But basically, you will give that to help with asthma. Do know that as long as you usually do it between 5 and 7 days, you don't have to taper them for steroids. So once you get into that 7, sometimes 10, even 14 days, then most endocrinologists recommend that you taper off the steroids. Definitely 14 days. That 7 to 10 is kind of borderline. Albuterol. Last thing, so this one you definitely need to know about. You can give it a nebulizer. Those are the treatments that you kind of see with them put it on their face, and it goes, it's inhaled. And then you have the MDI, where that one goes in their mouth, and it'll take 2 to 4 puffs. Basically, there's different ways to treat asthma, and there's a lot of different algorithms out there. A lot of different pediatric asthma scores to look at. But basically, 1 neb is about 2.5 milligrams a dose. And then a puff, 2 to 4 puffs equals kind of that same thing. So if you want to give a kid a 2.5 milligram dose, which is 1 neb, you usually want them to do about 4 puffs. Yes, it can cause them to be a little tachycardic, meaning they breathe a little bit fast. But just knowing that there's different ways to give albuterol, and that's a treatment for asthma, is definitely things that I would know going into your pediatric rotations. Hopefully this was helpful for you today. This is a handout I usually give to all of my learners rotating with me. Hopefully it was helpful for you to kind of know some things to go in, especially if your rotation starts tomorrow. Have a good day. Bye-bye.